We did an episode on the AHCA. Then we did an episode on the CBO report on the AHCA. Then everything seemed to fall apart. What happened? This is Healthcare Triage News. I hope that, unlike some presidents, you've been watching Healthcare Triage, and you know healthcare reform is hard. It's really, really hard. So it's no surprise that Republicans had a tough time getting something done. You can read any number of pundit pieces laying the blame on one group or another. But the truth of the matter is that at the end of the day, healthcare reform is really hard. It requires trade-offs. Those trade-offs, unfortunately, got short shrift in the partisan environment. For instance, many people argued in the last campaign that premiums are too high. Many people argued that deductibles are too high. Of course, as we've explained many times in previous episodes, plans with lower premiums come with higher deductibles. Plans with lower deductibles come with higher premiums. You can't have both. Trade-offs. Of course, you can lower the amount that individuals spend on both premiums and deductibles if we increase subsidies. Give people more money from the government, and they will need to spend less of their own money. But that will mean increasing government spending, not lowering it. If you want to lower spending, your ability to make either premiums or deductibles lower is limited. Trade-offs. What happened last week was that a lot of politicians wanted things that aren't reconcilable. Some wanted significantly lower government spending, but as I noted earlier, you can only reduce spending by lowering quality or reducing access. Other politicians were uncomfortable with reducing access. They didn't like the idea of millions of people going uninsured. And like I said, you can't reduce spending without having to reduce access or quality. Moreover, a whole bunch of politicians wanted to repeal the taxes and fees that keep the whole thing going. That was a reduction in revenue of about $600 billion over a decade. If you're going to cut those taxes and therefore cut that spending, well, something's got to give. Trade-offs. People hate the mandate, but that's what keeps adverse selection from happening, which keeps premiums down. Others hate the fact that young people are charged more than they would if they weren't in the market, but charging young people less means charging old people more. Trade-offs. Some people hated the idea that we force everyone to buy comprehensive insurance, but you only get around that by eliminating services or coverage that others need. When some people are charged less, others will be charged more. At some point, serious healthcare reform will involve a negotiation. What services and features do you want, and what are you willing to give up for that? You have to find enough people who think the gains outweigh what they're being forced to concede. But when we're unwilling to acknowledge the trade-offs, we wind up in a situation where we think we never need to concede anything. We believe somehow that we can have it all. Even worse, Republicans wound up in a place where the things some of them wanted to keep were the exact things others wanted gone. That's not possible. But that's where they were. And concessions to one group meant angering another even more. By the end, almost everyone was angry. The healthcare system is far from perfect. If there's one theme of healthcare triage in general, that's it. Another, though, is that healthcare reform is all about trade-offs. The sooner politicians start to acknowledge that, and the sooner they're willing to accept they can't have it all, the sooner we'll make headway towards making things better. Healthcare Triage is supported in part by viewers like you through Patreon.com, a service that allows you to support the show through a monthly donation. Your support makes this show bigger and better. We'd especially like to thank our research associates Joe Sevitz and Jonathan Dunn, and of course our Surgeon Admiral Sam. Thanks Joe, Jonathan, and Sam. More information can be found at patreon.com/healthcaretriage.